how has security architecture, how is it changing, or how has it changed to adapt to the new threats and the new, really COVID and whatnot? We've got just a whole host of new things coming at us. How is security adapting to that?
I think how it has to adapt and how it's adapting are two different things, Bill. Architecture, engineering of cybersecurity has to be at the forefront of every organization. And I would say, if you look at key things, this ability to identify threat, to protect against it, the ability to detect, it all begins up front in architecture. And I would tell you, I think a couple of things are key. Number one, third party has to be divided into two buckets: pre-purchase and post-purchase. And by that, what I mean, Bill, is what do you do before you purchase the product? And an examination of the company, the product, classification of the data that's in use, understanding the risk classification, pre-purchase, putting that all into what I would call a vendor inventory, where I list every vendor, every product, what's the classification of the risk associated with that vendor, what is the data, where is it in motion, and then affecting the contract. That's what pre-purchase security architecture is all about. And then if you shifted and said, what about post-purchase? We can't neglect that. We've seen too many healthcares who have had partner breaches. And in those partner breaches, what HHS and OCR are expecting, and what we have to do, is look at some type of mechanism to examine what are they doing after we signed the contract. What are the controls? Are they maintaining the controls? And so a third-party assessment team, security architecture, has to have the pre-purchase and the post-purchase. And in that post-purchase, there are now today, Bill, many organizations that are offering, like credit bureaus, they're offering monitoring services to tell us what's going on over at partner X or Y. And if you have breach, you certainly ought to be having in that post-purchase some type of analysis. What did they do? What did the breach look like? How did it affect me? Did it cause harm to services? And so those two elements of security architecture are key. And I would tell you, Bill, I think if you looked at the balance and the blend of an organization in security today, this is the heavy, this is the big and the important. This is where basic block and tackling will get done, is understanding and putting controls around every product, every development activity, everything that happens, and then having another team to post-purchase monitor and using some services so that doesn't become too heavy. But I think this is a lion's share healthcare security today. And in the past, most of our efforts in healthcare focused on, let's just have some tools to protect us. Let's have an endpoint protection tool. This is the future of getting a good strategy into place, Bill.